How to use guide to choosing health coverage properly. Beginner mistakes that cost you. Choosing the right health coverage is more than just picking the plan with the lowest premium. Most people get this wrong, and it can cost you thousands in unexpected medical bills. The first mistake beginners make is focusing solely on price. Low monthly premiums can be tempting, but they often come with high deductibles, limited coverage, or narrow provider networks. Always consider total costs, including out-of-pocket maximums and co-pays. Another common error is not understanding plan types. MoPo and EPO plans differ in flexibility, referral requirements, and network coverage. Selecting the wrong type can restrict access to your preferred doctors or specialists. Many people also overlook prescription coverage. If your medications aren't covered or have high co-pays, you could face surprise expenses every month. Check the plan's formulary to ensure your prescriptions are included. A surprising mistake is ignoring preventive care benefits. Many plans cover screenings, vaccinations, and wellness visits at no extra cost. Skipping this step means missing valuable care that keeps you healthy and can save money long term. Finally, beginners often forget to review plans annually. Health needs change, new discounts appear, and plan options evolve. Reassessing your coverage each year ensures you're always getting the best balance of price, coverage, and flexibility. To properly use a guide to choosing health coverage, focus on total costs, understand plan types, verify prescription coverage, consider preventive care, and review annually. Following these steps keeps you protected, saves money, and ensures you have the care you need when it matters most.